Welcome to Hey Dr. Sue. So people submit their sex questions to me anonymously, and once a week I post one question and one answer. Do you have a sex question you've always wanted answered? Go ahead and check out the description for information on how to submit it anonymously. This week's question. I hear a lot about HPV and its connection with cervical cancer, but do males experience any negative symptoms and consequences from HPV? Short answer is yes, and I have to say I'm so glad this question was asked because so often when we talk about HPV, we focus on women. A lot of the information that people are getting from HPV is about its link to cervical cancer, but that doesn't mean that there are no issues for males. Some strains of HPV can cause anal cancer and penile cancer in men, but before you go freaking out, both of these types of cancer are really rare in the United States. Keep in mind that some strains of HPV, which stands for human papillomavirus, can cause genital warts for men and women. And while the warts won't kill you, you're going to have to deal with them. Right now, there are a few options for getting rid of the warts, including removing them by freezing them off or through surgery. But just because you got rid of the warts doesn't mean you got rid of the HPV. The warts can come back after treatment. Maybe you're thinking, I don't need to worry about HPV, it's not that common. Think again. The CDC says that HPV is so common that nearly all sexually active men and women get the virus at some point in their lives. So how do you avoid HPV? Don't ever touch anyone. But let's be honest, that's not how the majority of people want to live their lives. If you're going to have sex, either vaginal, oral, or anal, use a condom. But keep in mind, they aren't perfect. Let me say this again. Condoms are not 100% effective at preventing HPV transmission, since HPV can be outside the area that's covered by the condom, but they're way better than nothing. So use a condom, recognize you may be at risk of contracting HPV or another STI, and get to a doctor if you see something that worries you on your genitals. And don't forget the vaccine. If you're between the ages of 9 and 26, you're eligible for the HPV vaccine. Did you enjoy that video? If so, make sure to like it. Also, make sure to subscribe. It lets you know when new videos are coming out and it helps to support the channel. Check out the description for information on how to find me on Instagram and Medium.